So when I started at the Division of Substance Abuse and Mental Health in the state of Utah, we had no dedicated personnel that were specifically working on suicide prevention. It wasn't in our state plan spelled out, and it wasn't in our directives to our local authorities, our subcontractors, our county providers, and we were among the 5th to 8th highest state in suicide deaths, and we knew that, for every death there were a lot more people who were making attempts and who were thinking about suicide. When we looked at the lives lost and the impact that was having on families and communities, we decided it was time for us to take action and put together a plan and a vision and get the infrastructure in place to address it. And so when we said, okay, we're going to do something, everyone was interested and everyone came together to work towards a common goal to reduce suicide in our state. And we took a kind of field of dreams approach where we said, if we build it, they will come. And we had some early adopters who decided to really investigate the tools and the interventions and the vision that we were creating, and it took off from there. Our local mental health authorities, our county-based public system providers dovetailed their suicide prevention efforts with their Medicaid PIP, their performance improvement plan. And then we also worked with some of our public and private systems, health systems, and they caught this vision as well. Our two largest provider systems, Intermountain Healthcare and the University of Utah Health Network, both have dedicated suicide prevention staff now inside of their healthcare systems as well, from this state-led movement of really focusing on what is needed and how to do it and how to implement it. We also now have a dedicated person in our medical examiner's office who just looks at suicide. The important thing about having infrastructure in place is that those people are going to be focused on it. It's not going to come and go with fads. It's not going to come and go with changes in leadership, with inside the governor's office or inside the legislature. When you have infrastructure in place, you're really able to focus on the problems and really able to develop good plans that can address the issues at hand. And so getting the infrastructure in place, that survives any of us. That survives all the elected officials and all the appointees, and you're able to see the long-term effects of that work. And we've gone from a budget of really nothing specific to suicide prevention. If you start adding up all of those staff and then all of the projects and the programs that they operate, there's about a little over $40 million in our state system going towards suicide prevention and risk and protective factors that we know help with other prevention efforts as well. For the last 2 years, we've seen a decrease in the rate per 100,000 of our suicides in the state of Utah. And it's because we have the infrastructure in place that has been developed through partnerships with so many people. So, the SPRC recommendations really help operationalize what it is you need to do, and we've been able to take parts out of the operations and out of the infrastructure recommendations and add them to recommendations from our own Utah reports and our own Utah data to make compelling cases to the governor's office to the legislature about the need for the resources that we have. This last session, even in the midst of a pandemic, our legislature prioritized crisis infrastructure for receiving centers that will directly reduce our suicide rate, because people will be able to walk in and get help. When you start talking to survivors of suicide loss and you start talking to people who have lost loved ones, it doesn't take any time to change hearts and minds to say this is something we need to focus on. And then finding and looking at the recommendations and the structure that is provided by SPRC with the guidelines really gives you a clear path to create what you need to address suicide and create suicide prevention that is infrastructure that's just going to make a difference in people's lives.